A new study by America's Health Ranking shows Texas is number 36 for women's mortality rates.
Yeah, that's a 25% increase, too, for women 20 to 44 between 2020 and 2021. So here to explain more about this report on the health crisis is the Vice President of Population Health and Clinical Strategy, Dr. Arethusa Kirk. Good morning. Thank you for joining us.
Yeah, good morning, Dr. Kirk. Covering all bases here, jumping right into it. What is America's Health Ranking right now?
So America's Health Ranking is actually produced by the United Health Foundation. It's the longest running state-by-state analysis of the nation's health. And it provides various insights to our populations, including older adults, women and children, and veterans. This report is our 7th report on women and children, and it uses publicly available data from 30 different sources and 122 measures. So that's the purpose, that's the background on the report. And the aim for it is for policymakers, officials, and others, including the public, to really understand the nature of population health trends across the United States.
You know, in recent years, Texas has been really terrible for women's mortality, maternal mortality. That's what we keep seeing year after year. And then specifically here where we live in Harris County, it's been particularly alarming for a well-developed area. So in a recent report that focused on women and children's death in Texas, can you share any of those findings? Is there any good news coming out of it?
Well, maybe let me just start with the mortality increased 25% over the course for women ages 20 to 44 between 2020 and 2021. And people may ask, what caused the increase? Throughout this report, one of the ways to sort of think about this is that low education, poverty, racial segregation, and inadequate social supports we think are contributing factors to premature deaths. We also note that there's a leading cause of death among women is injuries. And so unintentional injuries that are led by poisoning, motor vehicle accidents, cancer, heart disease, and suicide. So there are things that we can do to prevent unintentional injuries, certainly motor vehicle accidents, and that's maybe a call to action to the public.
Dr. Kirk, can you talk to us? And I know you already sort of touched on this, but what factors did the study look into? And can you also touch on the fact of about where we were maybe, say, 10 years ago to where we're at now?
Well, what I can say is that I actually don't have the 10-year-old stat, but where Texas is ranking now is 36th. I would say that there's 3 significant challenges of note in this report. The first is low prevalence of high school completion. Texas is actually ranking 49th across the states. And then a high percentage of uninsured women who are 19 to 44. The ranking is now at the 50th. On the good news story, we're seeing cigarette smoking has decreased 33%, and infant mortality actually decreased 7%. One of the factors on that is that we're tracking trends on infant mortality across the United States. And so while this is good news, we also see that there's overall disparities that continue to be an issue. So working to decrease injury deaths among women and children will help contribute to improvements.
I like you mentioning that we're declining, teen births, we're reducing vaping. Those are some improvements that are being made, and we need to pay more attention to preventative measures. We do know, though, that the healthiest states for women and children are Minnesota, Massachusetts, Vermont, New Hampshire, and Hawaii. So what are those states doing that Texas is not?
Yeah, I think I would point back to the sort of 3 main challenges for Texas that would be good to work on that would improve the rankings overall. And that really is the high school completion and the high uninsured rate and the high teen birth rate. The other factor that would be helpful to focus on is just the injury deaths in general. We're seeing an increase of 19%. And this is where I would really encourage policymakers, but also the public, to encourage safe medication storage, prevention of motor vehicle accidents through seatbelt use, safe car seats, helmets, and then firearm storage safety.
All right, Dr. Kirk, thank you so much for joining us this morning. We appreciate it.